My name is Olivia Braun, and today I'm going to be presenting over avian coccidiosis. In poultry, coccidiosis is an intestinal tract infection caused by the protozoa Coccidia. There are many different species within Coccidia, but Maxima is the most prevalent and problematic type. They come from the genus Emeria, which is responsible for all of the complex parasites that cause coccidiosis. There are 10 families within Emeria, at least 42 genera, and over 2,000 species, although only 7 species can affect poultry. Emeria's broad range of species all affect the intestinal tract, but with slightly different symptoms. It's also a parasite that will attack most vertebrates and some invertebrates, including humans. The economic impact of this disease doesn't seem substantial compared to the avian flu, but it can still cause losses of up to $3 billion globally per year, and at least $600 million just within the U.S. The U.S. spends around $90 million trying to treat this disease yearly as well. This goes to show how persistent the parasite can be, because we put millions into preventing this disease each year and it still causes large losses. Clinical coccidiosis is one of the main reasons for growth delay, poor feed conversion, and high mortality in intensive farming of broilers, cage-free pullets, and breeders. Symptoms of coccidiosis can include severe diarrhea, which is the most telltale sign as it's attacking the intestines, lethargy, weight loss, or a decrease in growth, pale skin around eyes and combs, and a decrease in performance, whether that be a decrease in egg production for layers or in appetite and growth rate for broilers. In some cases, it can also lead to death. However, severity depends on factors such as the host, parasite, and external factors. Bird age and status of immunization, number of ingested oocysts, species involved, and things like ventilation and wet litter need to be taken into consideration. The pathogenesis of an infection can vary from mild to severe based on the magnitude of the infection. The life cycle of a single Coccidia parasite is 4 to 7 days, and it's very progressive. There are 2 phases to the life cycle, exogenous and endogenous, which I will get to into the next slides. Oocysts, which are essentially eggs containing the parasite, are picked up or eaten through the feces of an infected bird. So the first stage of infection is asexual, where unsporulated oocysts are shed through feces into the litter, where they become sporulated. They get ingested and release sporocysts and sporozoites into the intestinal epithelium, which are produced by the sporulated oocysts that formed before ingestion. This is considered excistation, where the parasite escapes from the cyst, which would be the oocyst. And then this slide also pictures unsporulated oocysts versus a sporulated one. The pictures aren't the greatest quality, I'm sorry, but they were the most detailed pictures I could find. And you can see that B has 4 sporocysts, and inside each sporocyst there are 2 sporozoites. The produced sporozoites then penetrate gut cells and the epithelium to initiate asexual schizonts. The schizonts produce merozoites, which will then penetrate even more gut cells, and this produces a whole new generation of schizonts. They do this asexual multiplication because it's essentially an exponential increase in parasite numbers, and this is part of what makes them so powerful. The more asexual parasites there are, the more it can sexually reproduce and create those new zygotes. From the schizonts, male and female gametes form. The male and females will fuse to form zygotes, which over the course of a day will turn into immature, unsporulated oocysts that are ready to be excreted through the feces and picked up by another bird. Each cycle that occurs creates thousands of new oocysts present in the environment, and they produce at a rapid rate of 4 to 7 days. This makes them particularly dangerous to young or immunocompromised birds who can't keep up with the quick reproduction of the parasite. The multiplication of Coccidia is increased in warm and wet conditions, where oocysts will survive for up to 18 months and it's particularly common in cage systems where birds are confined in smaller spaces, and it's more likely that they will ingest another bird's feces. Each cycle that occurs creates thousands of new oocysts present in the environment, and they produce at a rapid rate of 4 to 7 days. This makes them particularly dangerous to younger immunocompromised birds who can't keep up with the quick reproduction of the parasite. The multiplication of coccidia is increased with warm and wet conditions, where oocysts will survive for up to 18 months, and it's particularly common in caged systems where birds are confined in smaller spaces, and it's more likely to occur that a bird will ingest another bird's droppings. I'll talk about treatment, but the most important and economic way to save your birds from coccidia is prevention. Having a clean and dry environment will eradicate conditions that coccidia can survive in for long periods of time. Good biosecurity is always a good habit to incorporate into your farm, and it prevents spreading coccidia to your birds from outside of the facility. Adequate space will deter birds from consuming each other's feces and spread the disease from bird to bird. The all-in, all-out method is also a great way to ensure that your birds stay healthier because the facility is being properly cleaned and disinfected of any coccidia bacteria after each generation. A clean feeding space is one of the most important things you can have because it's an easy way for them to ingest oocysts with their food. A raised feeder and fresh feed is always recommended. In backyard flocks and on some farms, amprolium may be used to treat coccidiosis. It's sold by the gallon and mixed into feed or water as an oral solution. It's given to chicks as a preventative, and medicated chick feed always has amprolium in it to build up their immunity from a young age, as this is when they're going to be most susceptible to the disease. During the last few years, coccidiostats have been worked on. Ionophores and synthetic drugs have been experimented with in vaccines and treatment of coccidiosis because ionophores usually cause death to the coccidia parasites, and chemicals break down the parasites by things like inhibiting mitochondrial respiration or inhibiting the folic acid pathway, which all cells need for growth. The problem with these drug treatments are that drug-resistant strains may emerge, so rotation systems for anticoccidial drugs are important. One of the more common vaccines is called Evelon, which is a live vaccine given orally. Hatchpack, cocci, and Zoetis vaccines are also very commonly used. And then, before I get into the highlights, I just wanted to tell you guys the newest solution to coccidiosis is botanical warfare, which is effective and is said to prevent resistance and works to replace those coccidiostats and antibiotic growth promoters with a few other benefits. It has the potential to give better profit and a higher return on investments for poultry producers. Oregostim is a natural feed additive consisting of oregano essential oil, and that's been researched and tested and is able to increase performance by improving the bird's feed conversion ratio and body weight in broilers. It helps reduce the mortality caused by gastrointestinal pathogen invasion, so not necessarily just coccidiosis. I thought that was a really cool fact, and I wanted to share it with you guys. And then I will get into the highlights. So, coccidia is an intestinal tract infection from genus Emeria. The main symptoms are severe diarrhea, weight loss, and lethargy. It has a 4 to 7 day life cycle, which is an asexual and then a sexual stage. It can be prevented with proper care and good biosecurity. And finally, it can be treated with amprolium, and hopefully soon we'll be seeing more of that botanical warfare with the oregano and that more natural route. So that's all I have for you guys today. Thank you for listening.